Hi, I'm Wendy Skippa, your medical reporter. I'm here today with Dr. Mickey Gordon of Gulf Coast Foot and Ankle Center. Dr. Gordon, thank you for being with us today.
It's my pleasure. Thanks for having me, Wendy.
So I have some questions for you. We have a lot of parents and grandparents that have been asking questions about children. What children's foot disorders do you see most frequently in your 4 offices in Naples and Bonita Springs?
I think it actually depends on the age of the children. And one of the most interesting things, frequently a pediatrician will tell a parent that your children are going to grow out of the problem that you're concerned with. And what's interesting, if that would happen, I'd be out of a job. At different ages, people's feet will developmentally in-toe and out-toe, and that's normal as the bones in the legs start to develop. What we see in, say, a 9 or 10-year-old boy or girl is posterior heel pain, which is actually a growing pain. It's called calcaneal apophysitis. That's where the bones in the heel are starting to fuse. Very frequently, we'll see children with warts. We'll see children with ingrown toenails who have been digging at it and who don't tell their parents, especially as they get older, and it can be very severely infected. Occasionally, we will see juvenile bunion deformities. In fact, the youngest patient I've operated on for a bunion was 12 years old.
Oh my. We
also see many children with flat feet. It's very important to get that treated. Normally, that is treated with an orthotic or a minor procedure where we put something in the subtalar joint to help create an arch. Because the bones actually develop around force vectors. So if the arch is normal, the bones are going to develop more normally, and maybe the children will not have a difficulty as they become an adult or a teenager.
What is something that parents should look for when they're purchasing shoes for their children?
Just that it fits them properly and not be tied to what's the most fashionable that their children are going to want. They need to be sensible, but they also need to be able to fit in. Normally, people hear that for young kids, you want high-top shoes. And that was just sort of a fallacy because it was harder for the children to remove them. And normally that children can get out of anything.
So it's not really a concern.
Anything, can't they?
Okay, well, thank you for that. Is there anything parents and grandparents could do to prevent future foot problems for children?
Yeah, they should probably have the children's feet evaluated professionally.
At what age do you recommend that?
It depends if they notice something abnormal. I think everyone will notice that a little baby has really cute feet with no arch, and that's supposed to be normal. But if they start to in-toe or walk on their toes, or their feet are very flat, or they notice a deformity or a pressure spot, then they should be evaluated. If not, probably by the time they're 5, they should have their first visit. By the time they're 12, a second visit.
When you mentioned before about flat feet, is that something that one can observe by looking at the foot, or is this something that you need to be the one to diagnose?
Parents can see that when their child is walking barefoot. Everyone knows what the arch looks like on a foot, on the inside of a foot. And if it's too flat, then it needs to be appropriately diagnosed and treated.
Is it something that causes pain to the child?
No, normally it won't cause pain until later adult life. If a child is complaining of pain, they normally have pain. If they're not running and playing with their peers, then it is a very,
it's a sign
very
of
strong,
something.
Yeah, it's a big warning sign.
Because they may not verbalize it, but it may be something you could observe and step in.
And if they're limping, the only time I've ever had children complain of pain where they didn't have it was actually when the parents weren't getting along and were in the process of a divorce, and the child needed some attention.
Interesting. Well, thank you
I'm fascinating, aren't I?
Thank you for being with us today. All of this information has been very interesting, and I'm sure very useful as well to all of our viewers. We appreciate it, Dr. Gordon. It's been nice having you.
Thank you. I hope people find something useful.